Welcome back to Sleep Better TV, and in the second part of our discussion with Dr. Mark Levy, he's a dentist in Columbus, Ohio, we're going to be talking about oral appliances. Welcome back, Dr. Levy. Why don't some doctors recommend oral appliances?
Couple reasons. Historically, the CPAPs were first. They are not trained to do anything. Sleep doctors are not trained to do anything other than diagnose and treat their patients with CPAPs. Unfortunately, I've read statistics that up to 75% of CPAPs are used as doorstops or put away under the bed after the first year. I've read 50% at the end of the first week. So there needs to be a viable option. Another reason why they don't recommend them is that they don't know much about them, which is unfortunate. I mean, that is changing. They're starting to learn. They're inquisitive. They want to be partners in this with us, and we need them to be partners with us. There are some people who say there might be a profit motive in them because they don't do oral appliances, and by definition they can't do oral appliances. It's strictly the venue of the dentist. So everyone's trying to get the word out. Saves lives.
And is it true that oral appliances are particularly effective for mild to moderate cases?
Statistically, yes. As a matter of fact, in I believe it was 2005 or 2006, the American Academy of Sleep Medicine, which is the physician's organization, not the dentist organization, came out and said for anyone with mild or moderate sleep apnea, or even any patient who has severe sleep apnea who's unable or unwilling to wear a CPAP, should go to an oral appliance. But they've actually come out and said for mild or moderates, you can start with an oral appliance and not even try a CPAP.
So Dr. Levy, is this something that any dentist can do? And what kinds of tools or equipment are you using here?
Sure, by definition, any dentist can do this. By definition, any dentist can do impacted wisdom teeth, but rarely do we see that happening. It's not complicated to do it, it's complicated to do it right. It's a situation where we have up to 100 options, 100 different designs of appliances that we need to go through in our minds to determine which one is the best for this particular patient. That's the first step. The second step is getting that patient in the proper position. To that end, I do have some equipment, it's called a pharyngometer, and that measures the opening of the airway in a regular position and with an appliance in their mouth, or as I'm testing. And that really speeds up the process. It gets me to the final goal position much quicker. Do you have to have it? No, but I have it, I use it every day. It just makes things go smoother.
And as a dentist, how did you get involved in treating sleep breathing problems?
Now, I've been doing TMJ treatments for close to 15 years now. And I determined early on that there had to be something in addition to my treatments to solve the puzzle. TMJ pain, headache pain, and I started doing my research, and it turns out there's a strong relationship between patients who have TMJ problems and also who have sleep apnea problems. So I eventually got trained many years ago on sleep apnea, and things have just evolved. I mean, the rate of sleep apnea these days is incredible, and as the population ages and as the population puts on a little bit of weight, the odds of having sleep apnea are just skyrocketing.
All right, once again, Dr. Levy, thank you so much.
Sure.
My guest has been Dr. Mark Levy from Columbus, Ohio, and you're watching Sleep Better TV.